And it's really nice to hear, but I don't know that anybody else thinks that.
I don't know. Okay, this is how I see it, right? It's gratitude makes people feel good, right? So if they're thinking a little bit more about being grateful for what they have, they'll be more inclined to focus on what they have and not what they don't have, right? And it changed that. But there's just a little step extra. If it's nice that I feel gratitude for what I have, but wouldn't it be nice to share that with a person who's done things for me I couldn't do for myself, and they've taken off that strain? So it does a couple of things, right? One, in my head, I'm sharing it. So I'm one, the second thing is I'm validating someone's help, right? And two, it also communicates with them that because I like you doing that, they're more maybe inclined to do
it again.
Like the dogs,
always,
right?
Always. And one of my favorite dance instructors, his very first lesson, he said, if you find a dance partner you like, he was telling this to the men. He says, if there's a dance partner you like dancing with, tell her what you like about it.
Yeah.
Because then she'll do more of it.
Yes. I do have a question for you, right? This is something I've noticed here in Australia. People are not inclined to say thank you. I'm not talking about just courtesy, right? I'm talking about in general. And I remember in our culture, it is very highly valued to say thank you. Now, for me, in the beginning, as I was a child, and I didn't really care, it was drilled into me. So right, make sure you stay in the left-hand lane, because we're going left. So it was drilled into me when I was a kid, as I've grown up. But it's become, I really like telling people thank you. I'm sincere about it. I'm not going to say it if I don't mean it. Now, I'm curious, because you're very traveled, you've lived in so many different places. Is that a cultural thing? Or is, to me, courtesy / morals, for lack of a better word, has to be taught to a degree. Because you learn as a child that it has long-term benefits.
I think it's a given in every culture that politeness includes saying thank you. But from our previous discussions, I'm wondering whether you're talking about that or whether you're talking about
my love language?
No, you're talking about the value of that thank you.
Right.
Right? Like the emotional currency. Does that make sense?
Well, if you take traffic, just as an example, when I let someone in, right, that's a choice that I'm making.
Yes.
If they say thank you, I'm actually more inclined to do it, because I'm like, oh.
Yes.
If someone lets you in, if I let 5 or 10 people in and none of them say thank you, you start to go, well, thanks.
Right.
And then you become less inclined to want to let people in.
Yes.
You see where I'm coming from? So I'm like, it's a way to go, thank you so much. I see that you've considered me.
Right.
So I if you want people to let you in, say thank you.
Yes.
Now, there are some people who don't care, but more often than not, they actually do. Does that make sense? That this is what my brain says.
It makes sense, but what I'm going back to the cultural thing.
Right.
Every culture, courtesy is valued.
Courtesy is valued, yes.
And children are taught to be courteous. So whether they continue to do so as adults,
it's different.
Is an individual thing. It's
That's
how much
true.
value the parents put on it.
Yes.
But I think every culture has that at its base.
Yeah.
I think.
But it's in my head, I'm thinking, if you want to go cost-benefit analysis.
Absolutely. It costs you nothing to say thank you, and the benefit is huge.
So great. Yeah.
Always.
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 All right, so let's start that conversation that I want to talk about.
Okay.
So yesterday, one of my clients said, hey, my dog is, 9 months old, 9.5 months old. We went to the vet. She loves going to the vet. She's not afraid. But boy, oh boy, is she excited. Like, she's all over the place, right? And as I've worked with her over the last couple of months, I'm watching this dog and I'm like, I think your dog is in pain, your pup, because she does a lot with this dog. you know, because she wants to give her exercise. And a lot of breeders will sometimes mention that we shouldn't do as much with puppies as they grow for the first year, you know, so we give their joints and everything a chance. So they say don't do as much. They don't say don't do anything, because
Right.
you still want to stress the muscles and ligaments so
Right.
they get strong. So I'm like, I don't know why, but I'm in my head, I'm like, there's definitely pain here. And as I did the little skin folds, and I was very gentle, Ruby responded every time by moving. So turn
Yep.
her head,
Yep.
move her butt away.
Yep.
And I was like, I think you need to do a pain assessment.
Yeah, and what I would say to that right away is there are 4 responses that any dog will have to fear, right? The 4 classic responses are fight, flight, freeze, or fidget. Fight and flight are easy to identify. You
Yes,
can tell,
because it's,
right?
and usually that's usually the not so subtle ones.
That's when you haven't listened to any of the earlier signals, and the
Yes.
dog is like, come on.
Yes.
Right? But freeze and fidget are very often missed, and what
Yes.
you're talking about is fidget.
Yes.
If a dog cannot sit still, it doesn't mean they're excited. It might mean they just don't know what to do.
Because
know?
you're clearly not listening to
Exactly.
to like ow, ow,
Yeah.
ow.
Yeah. Yeah.
But I want to talk about the that, and you wrote up something, and I want you to talk a bit about the
Okay,
pain, because
so-
the first layer of the layered stress model is health, and
Right.
that includes diet. But we're not talking about that today. We're talking about the physiological health of the dog.
Right. So I wrote up a document to be used within our rescue because so many people, even if they have experience with dogs, miss this, right?
Yeah.
So we start off with that description of fight, flight, freeze, or fidget, and what all those little signs are. I liken that to a stop sign of green, yellow, red, right?
Go
so,
on then.
So the green light means go ahead, I'm happy. And
Right.
green light signals are very easy to identify. The dog is relaxed, wagging its tail, approaching you, right?
Allowing you.
Right, that's green light.
Yeah.
Red light is that fight or flight. You know, they're growling, they're snarling, they're trying to get away from you. Those are also quite obvious. What we miss are all the yellow light indicators. And these are things like lifting up that front paw hesitantly. Whale eye, where if you can see the whites of their eyes, like they're opening their eyes really wide. If they're licking their lips, that can be a sign of nervousness. They could also be thirsty, but it is
But
a
you got to
sign
see
of
context, right?
Right,
So
exactly.
if the dog's drinking water already, if the dog has already eaten, you know, like if there's something on their lips and they're licking it off,
Right.
like, you know, put it
Right.
in context.
Right. But if you're trying a new activity or have taken them someplace new and that dog is standing with one paw up, licking its lips and looking around, you know, at you with big white eyes, they're telling you they're afraid. Okay? So fear can apply to pain
Yeah, of
in
course.
that a dog is afraid of being hurt, or if it has an existing injury, it's afraid of you aggravating that injury again. And so they will do all those things. They might try to move away from you, but if you
distance.
right, if you insist on keep going up to them, then they might do the other things, which is the whale eye, the licking of the lips, and so I've worked with a lot of dogs that were relinquished for behavioral reasons. For they were getting narky with the kids, they
was
were
the
starting
obvious.
to snap. Right, those are the obvious. And I thought we need to look at underlying pain as a source of this behavior. The issue with pain is that most conventional vets will miss that because a dog is designed to hide pain. If they show pain, it affects their status within the pack. They are labeled weak.
Well, you become a
and-
target.
Exactly.
Because that's what lions do. That they identify the weaker of the species so
and
they
take
can
them
hunt
out.
them.
Yes, exactly. So dogs are designed to do that. By the time they're showing pain, by the time
Obvious pain like limping.
yes,
Yep.
by limping or not putting weight on a foot, they're in agony. They've been in pain for quite a while before that.
Would you say then it's chronic? Like
Yes.
it's chronic?
Yes. By the time you see it, it's going to be chronic.
Yeah. Which means long-term
Long-term,
rehabilitation.
intense. Yeah.
Intense, yeah.
Yeah. And most vets will not see it before that.
And they're not
right?
trained for it.
They're not trained for it. So if you bring your dog in for a regular health check, the vet has what, maybe 10 minutes? They're not asking them to walk up and down while they watch them. You know, they're checking their heart rate, they're giving them a quick feel so that there's no obvious broken bones.
Yeah, they're looking for very obvious, like first layer triage kind
Exactly,
of things. Yeah.
exactly. So it's very common for them to miss it. And that's not a bad thing, okay?
No.
But when you take your dog to a pain specialist, man, they take 4 or 5 hours to assess your animal, and they're going to put it through all different kinds of paces. They're going to do lots of different palpation. They're going to stretch the joint, flex it, you know, and they do that with every joint to figure out what's happening. And what I wrote this document up for, I did it with the assistance of the pain specialist at Veterinary Rehab Veterinary Rehab Services, and Dr. Yoko Clinch. She actually taught me a lot of these techniques, and then when I had her proofread the document for me, she added a few more. So it's a really good place to start, especially if you've got a dog that already has some behavioral stuff going on. They're going to respond better to their owner touching them and putting them through these tests rather than an unknown, a scary vet. Right?
It's someone who they don't know yet.
Correct. So did you want to go through the different tests, or?
I do, but I just want to mention, so in my training system, when I get new, people who are interested in training with me, I take them through a basic foundation, right? And a lot of people really focus on the clarity of Doggy Dictionary and all that, but I really try and insist on the conditioned relaxation. And part of that is massage things. It's not nearly as inclusive or as intense as what we're going to discuss right now. And I'm I'm gonna start doing this with the little babes, like the ones that if once we get the dog's DNA test back, and I'm happy with that, and we have this litter of labs, that is one of the things that I'm gonna get my puppy party people to do is that stuff, because the more people that handle the puppy, right, the more the puppy gets used to it, and the more people we educate.
And people don't realize how very common it is for us to get animals where the owner says, oh, they don't like their feet being touched. You know, I can't get his nails done without sedating him because he doesn't like getting his feet touched. Well, if you start touching his feet when he's a puppy, you're not going to have that problem.
Yeah. So the first thing is, like, when I talk about that stuff is, have you been doing it? Like, is the dog used to it? And if the answer is no, it's like, well, why don't you do it?
Right.
You know, and then the second thing is, make it easier on vets. Make it easier on the vets, on the groomers. People take their dogs to these professionals because they don't want to deal with the dog being like that. But the problem is, you're putting a person, that person is at risk, and they have to do that 5, 10, 15 times a day. Right. And then you complain about how expensive it is. And I'm like, well, they need lots of insurance, for one,
But if you prepared your dog in the first place.
Yeah, it's so much easier. Yeah. And you might not even have to pay that now because you can do it yourself.
Exactly.
And I mean, if you want to pay someone to do it, fine, but it will be easier for them.
And it's stressful for the dog. Even if the person is a consummate professional and knows how to do it, your dog is still stressed.
Yeah,
because the whole time they're having to do that.
You haven't helped them in that regard,
Correct.
And the one thing I do want to mention in here, and just before we go into that, is I feel it's unethical to force a dog to tolerate that, in terms of my dog's snarling and, want to bite my kid, make him stop. And it's like, well, that to me is unethical to say, hey dog, you have to,
you have to live with this.
You have to live with this and tolerate being harassed. Right. Especially if somewhere down the line I'm like, this dog's in pain. Like, I don't like, it's like that person that keeps coming to you and touching your bruise. Yeah. And if you want to think about it yourself, I say to people, it doesn't have to be intense pain. Like, have you ever had like a background headache where it's there? It's not bad enough to actually be a headache, but it's just annoying enough to annoy you.
And every time you see your friend, they play their radio really loud.
Oh, yes.
And they're like, what? What's the problem?
Yeah. All right, so let's go through those things a bit.
Okay. So, very obvious one is just to watch the dog walk. Is it changing weight.
Observe.
Yeah,
Be
observe.
aware. Yeah.
Yeah, it's like, do their hips look normal? Are they moving their back? Yeah.
You need a baseline.
Yes, exactly.
I'm sorry, I'm going to just really quickly intervene there. When I worked for the canine security company, I had 8 black German Shepherds, right? And within 3 months, I could tell the difference, right?
By how
just
they
looking,
moved. Yep.
And I could tell when something was wrong just by observing. But it's going to cost you, the cost of that is observing.
Correct.
Time.
Correct.
Anyway, go on.
Okay, so that's the first thing. The next thing is that joints, all the joints on a dog should be able to be flexed, that is, the
Yes,
angle
like
made
bendy.
close, yeah,
Like bendy.
to the point that almost where the bones are touching each other.
Yeah.
That's what she said. I was very, I
Like,
guess
whoa.
I've had so many old dogs, I was like, you can't do that. She's like, no, a normal, healthy dog, you can fully flex the joint.
And I guess that's the thing, right? A normal, healthy,
Healthy dog, right. And the flip side of that is you should be able to stretch the joint out to its full, to its full
range
length.
of motion. She's
Full-
checking
yes,
range of motion.
And she'll do that on ankles, on elbows, stifles, shoulders, all of those, right?
Yeah.
So she checks all that. And the way you check the flexibility on the back is, say the dog has its head facing you and its tail away from you. You lure its head towards its butt with a piece of a treat while somebody else, or maybe you with your knee, holds that butt in place
So
that they
essentially,
can't walk in a
guys-
circle.
So essentially, guys, it's the food chase game that I teach people, the very first one, where we're doing a circle, but in this case, we're actually asking the dog to remain stationary with their bums and then just turning, so kind of like the shoulders and the head and the neck towards the side.
Right.
That's what she's talking about.
And you do it on both sides and you observe whether or not it's symmetrical.
There you go. So is it the same on both sides? If the
Correct.
answer is no, then we have
A possible problem.
problem.
Yes. If they are symmetrical on both sides and they're reasonably flexible, then you can attempt. It's basically a very gentle tail pull. You grasp the tail at the base of the tail,
Yeah.
where it connects to the body, and you pull away from them, parallel with the ground. If
Parallel with the ground, but also very like where the tail is. You
Yes.
don't go higher than the back or lower than the.
Correct. You're
Yeah.
not changing the angle on the tail.
Tail, no.
Right. And if the dog pulls away from you, oh, that feels good. That's a stretch.
Yeah, because.
But if they back up towards the tail, that means, oh, that's sore. I don't want to. And I want to interject here that some dogs don't want you touching their tails, period. And that may not be pain. That may be bad experience they've had with anal gland,
Anal
or
glands,
something.
yeah. Wink,
right?
wink, nudge, nudge, peeps.
So again, you have to take it in context.
Yeah.
If your dog doesn't like its butt touched ever, don't do this test.
Yeah.
Have the
but,
vet.
But tell the vet.
Yes, exactly.
Tell
the
them
vet.
it's very normal for my dog not to enjoy this.
Correct.
So the vet can go, okay, so there's a baseline here. Let's have a look. Is this a bad experience? Is
Correct.
it a learned thing, or is it like a no, I'm sore. Please don't touch me kind of thing?
And the other thing she said that is some dogs do not like skin on fur, on their feet especially.
Yeah.
Right? And so she said, put your hand in a towel, put a towel between the dog's foot and your hand, and you'll be able to manipulate the joint or the foot.
Yeah, the toes and things. Yeah.
And a lot of dogs will tolerate that, but if you touch them with your hand, they'll like pull away right away.
And again, you can, when a puppy is very young, and you can desensitize them to a degree, but then get to know the individual. Like some individuals never get over texture.
Correct.
Like I'm one of them, and I actually, like my stepsister, silk feels like wool to her.
Wow.
So you get her to it, and she's like, this is itchy. And that's just the way her brain is, and that's just the way it is. You're not going to desensitize that.
Right. And you're not going to automatically say, oh, that's pain.
No, of course not.
It's not. It's just a learned response.
It's a learned response.
Right. So all of these tests are things that you can do as an owner to get a baseline, and then based on that, you can make a determination: does my dog need to see a specialist?
And I think that's really good because some people, it is expensive.
It is,
but it's expensive, and the cost benefit is so good.
It is so worth it.
It is so worth it, and if it's acute, it's going to be a long-term thing.
Yep.
And that's why one of the things that happened to Ziva was she was overusing her muscles. She hit it very well.
But she kept getting worse and worse.
She got a little worse. I knew something was wrong. My intuition said something's not right. I took her to a conventional vet. My vet was really good. They listened to me, which is something, you know, over a period of time, my vet learned that I'm not I am pretty observant and all that. And I think that's wink, wink, nudge, nudge, giving them information. So even though they did all the normal tests, those tests are not for pain. You know, so it's like, well, her x-rays look fine, you know.
Right, her blood work is fine.
Her blood work is fine.
Yeah.
And I'm like, no, there's something's not right. Then taking her to the specialist, and from my understanding, guys, it's like the pain specialist is more muscular, where your normal vets are not. They're more joint, they're more bone, they're that sort of stuff. So that's different. That's like the difference between should I check my tires versus my oil, you know.
Well, it's the difference between a broken bone and a sprain.
Yeah,
they both
different.
hurt.
They freaking hurt. Yes.
Yeah.
And the thing is, like, some of the terms that some of the vets and medical professionals use is it's a spectrum. So if I say I have cancer, it can be a spectrum of very stupid.
Stage 1 to stage 4.
Yeah. And if they say fracture, if you have ever done first aid, you should know and understand, like, it could be a crack in the bone versus like an actual, like, it's sticking out of my skin.
Yeah.
So you got to be, you know, aware.
Yeah.
But I think being proportional, your treatment should be proportional to what needs to be done. But our expectations of our animals needs to be realistic as well and proportional. So I saw this with Ziva, and Ziva they said to me, your dog, Ziva, is going to go on a 12-month rehab program. You cannot exercise her. And this is a problem because the activities I had to do with Ziva before that was addressing her drive.
Right.
So I had to come up with alternative activities, and it cost me money. So I had to do a swimming pool.
Well, and ultimately, it still couldn't address her drive. So then you had to make the decision of whether or not.
Well, there was an added thing where when Ziva was so frustrated by not being able to address her drive. So before that, she cracked 2 teeth.
Yeah.
And I didn't know because it was on the inside of the mouth. You need an actual like thing to see it. And her teeth went to the vet. We got the dentist in, which is another specialist. There's only, I think, 2, in WA. I can't remember. Don't quote me on that. They're very rare and they're very, very expensive.
Yeah.
So doggy dentist. So on top of her muscular pain, and I couldn't address that drive, which means I couldn't give her an outlet for her stress. She then alternatively chewed, which wasn't normal for her. My dog was not a chewer.
But it was her only outlet.
It was her only outlet. And the problem with that is she was so intense in her chewing, she removed all the pulp cavities of every single tooth in 6 months.
Oof.
And what that means is every single nerve in her jaw, in her teeth, was exposed. And that's where I had to make the decision. So
I want to jump back. There was something that I forgot to say about the pain assessment. One of the very first telltale signs is your dog doing stuff differently?
That's right.
Has it stopped jumping up on the couch when it used to? Does it not want to walk as far or as long as it used to? Any change, you should be asking yourself, what happened before this? What might have affected this?
Yes. And it might not be obvious. And this is the thing with the Labrador that I took, which is being trained as an assistance dog. And I was like, no, something's not right. And it's only overuse. And don't get me wrong, like, the dog enjoyed it. Like, the dog's like, yeah, I'll run and I'll swim and I'll play and I'll do all these things. You know, and because the dogs enjoy it so much, the owners enjoy it with them. They do it all day, very often.
It's like a dancer. Telling a dancer not to dance because their foot hurts, more often than not, they'll ignore you.
Of course they will.
Because they love dancing.
Yeah, it's just that in that mind, like, that's a limbic system thing. It's a reactive thing. It's I like this feeling and I want it.
Yeah.
So it's a dopamine thing. It's
so if you're not responsible and you don't catch that in your animal, they're going to continue to injure and make that injury worse.
And the thing is, ignorance can be so expensive.
Yes.
And now in my head, your responsibility as the pet, like, owning the dog, which is a legislation, like a government kind of thing, or a pet parent, whatever you want to say, your responsibility should be looking after your dog.
Yeah.
Getting rid of your dog then for that, to me, is an irresponsible thing. And that is not good.
Well,
If
I
you
have
cannot
yes,
afford it.
exactly. I was just going to say that.
I mean, we can be reasonable, but
Yeah.
with this information, you might not have to.
Identifying
You
it
have
is
to
your
identify.
responsibility no
That's
matter
it.
what.
That's it. I agree,
Yeah.
100%.
Yeah.
100%. So, and that's something, it takes a bit of time to learn, right? And it takes, what the cost is, not watching Netflix for 5 or 10 minutes a day.
Right.
You know, and to me, if you're someone who says, well, I don't want to correct my dog's behavior because I feel that's cruel, before I get there, if you're not identifying these things, that to me is cruel.
Yeah.
Do you know, like, let's start a bit.
Yeah.
Because I agree, like, it's not fair to correct a dog if they're in pain, saying that dog's going to hurt me.
And sorry, I keep going,
Yeah, please do.
running through it in my head.
Go
The
for
other orange, the other, yellow light signals are things like: are they breathing harder? Are they panting?
Yeah, and it's not hot.
Exactly.
They haven't done any.
Exactly. It's those subtle changes, increase in heart rate.
But who checks their dog's heart rate? I don't even do that.
But if you're holding your dog, and if you start to move one joint, and their heart
Yes,
starts
yeah.
pumping
Okay, that makes
faster,
sense, yeah.
something's happening there. You know?
Yes.
Yeah.
I understand what you mean now. Because I'm like, I'm not carrying my dogs.
Yeah.
They can walk, they've got legs. But yeah, and this is the thing, like, there's some things that even I don't use, but I use other things.
Right.
Cool. Is there anything else you want to add before we...
No, I think that pretty much covers it.
So, if you want to be a really cool, responsible dog owner / pet parent, and you want to save yourself a bit of money,
Watch your dog.
watch your dog.
Oh,
Oh, look, there's a dog.
Fletcher.
That's all right.
Where is
won't
he? I
go
don't
very
want
far.
to.
He's here.
Okay, I don't want
That's
to
all right.
run him over.